ನೀವು ನಿಮ್ಮ ಗ್ಯಾಸ್ ಗೀಸರ್ನ ರೆಗ್ಯುಲರಾಗಿ ಮೇಂಟೆನೆನ್ಸ್ ಮಾಡಿಸಲಿಲ್ಲ ಅಂದರೆ ಯು ಮೈಟ್ ಎಂಡ್ ಅಪ್ ಇನ್ ಅನ್ ICU ಫಾರ್ ಅ ಕಂಡೀಷನ್ ಕಾಲ್ಡ್ ಆಸ್ ಕಾರ್ಬನ್ ಮೊನಾಕ್ಸೈಡ್ ಪಾಯ್ಸನಿಂಗ್. ಹಾಯ್, ನಾನು ಡಾಕ್ಟರ್ ವಿವೇಕಾನಂದ, ಪಿಡಿಯಾಟ್ರಿಕ್ ಇಂಟೆನ್ಸಿವಿಸ್ಟ್. ಇವತ್ತಿನ ವಿಷಯ ಏನು ಅಂದರೆ ಕಾರ್ಬನ್ ಮೊನಾಕ್ಸೈಡ್ ಪಾಯ್ಸನಿಂಗ್ ಬಿಕಾಸ್ ಆಫ್ ಗ್ಯಾಸ್ ಗೀಸರ್. ಒಂದು ವಾರದ ಹಿಂದೆ ವಿ ಹ್ಯಾಡ್ ಅ 13-year-old ಚೈಲ್ಡ್ ಹೂ ಹ್ಯಾಡ್ ಕಮ್ ವಿತ್ ಪಾಶ್ಚರಿಂಗ್, ಸೀಸಿಂಗ್ ಆ್ಯಂಡ್ ಆಲ್ಟರ್ಡ್ ಸೆನ್ಸೋರಿಯಂ. So further inquiry ಮಾಡಿದ್ರೆ we got to know that the child was having a bath and she fell unconscious. ಬಾಗಿಲನ್ನ ಹೊಡೆದು they had gone inside and got the child. So when we received the child, we saw that the saturation was not maintained because of seizure and posturing, and the BP was not maintaining. So we had to intubate the patient. So ventilator connect ಮಾಡಿದ್ವಿ. Then we just asked one leading question. ಮನೆಯೊಳಗೆ ಗ್ಯಾಸ್ ಗೀಸರ್ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ ಅಂತ. They said yes. Then we had a diagnosis that was carbon monoxide poisoning. So what are the symptoms? ಈ ಥರ ಪೇಷಂಟ್ಗಳು ಹೆಂಗೆ ಬರ್ತಾರೆ ಅಂತ. ಮೈಲ್ಡಾಗಿ ಏನಾರು ಅಫೆಕ್ಟ್ ಆದರೆ ದೇ ಹ್ಯಾವ್ ಹೆಡೇಕ್, ವಾಮಿಟಿಂಗ್, ಡಿಸಿನೆಸ್, ಆ್ಯಂಡ್ ಒಂಚೂರು ಜಾಸ್ತಿ ಆಯಿತು ಅಂದರೆ ದೇ ಮೈಟ್ ಎಂಡ್ ಅಪ್ ಹ್ಯಾವಿಂಗ್ ಸೀಜರ್, ಕೋಮಾ ಆ್ಯಂಡ್ ಆಲ್ಸೋ ಹೈಪೋಟೆನ್ಷನ್. ಸೊ ದೀಸ್ ಆರ್ ದ ಸಿಮ್ಟಮ್ಸ್ ದೇ ಪ್ರೆಸೆಂಟ್ ವಿತ್. ಸೊ ಇದಕ್ಕೆ ಏನು ಡಯಾಗ್ನೋಸಿಸ್ ಹೆಂಗೆ ಮಾಡೋದು ಅಂದರೆ ವಿ ಸೆಂಟ್ ಅ ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಫಾರ್ ದಿಸ್ ಗರ್ಲ್. So that is called as co-oximetry anta. So we got to know that the carbon monoxide levels were 15.9%. So it was pretty high. Anything more than 0.2 to 2.5 is abnormal anta helteve. It was high for this girl. So idikkene treatment ide. So we had to give oxygen. So what normally we give is 100% oxygen anta helteve. So we gave 100% oxygen through a ventilator. You can give oxygen either by a ventilator or by NIV anta non-invasive ventilation anta helteve, or by any of the oxygen measures you can give. So idadmele the child, after 12 hours we repeated co-oximetry. We got to know that the carbon monoxide levels have dropped down to 0.2%. It's a good news. Then we extubated the child and child is all okay now. So ivaga my concern is, what are the precautions you need to take if you are using a gas geyser? First, try to avoid using a gas geyser. Ittu andre replace it with an electric geyser. It's always better. Second, if you can install that geyser outside the house and get the water inlet into the house for your showering, that is the best way. Third thing is regular maintenance ಮಾಡಿಸಿ. ಅದು ಮಾಡಿಸ್ಲಿಲ್ಲ ಅಂದರೆ there will be incomplete combustion that causes carbon monoxide, and that will be a problem for anyone in the house. And the last thing is, if you are able to switch it off when you're using in the bathroom, that is always better. So if you follow all these measures, then it will be helping everyone, because who knows, you might end up having carbon monoxide poisoning and getting into ICU. Thank you. Happy parenting.